Hi, I'm Joe Rosario. I am the creator of the Postural Balance series, and we are today with Andrew. How are you, Andrew?
Very well, thank you.
Andrew has been a patient of mine for a while. For how long? Do you remember? Like 6 months?
Yeah,
or something like that?
Close to 6. Yeah.
Yes, and it's really interesting because Andrew has a herniated disc, right?
Yes.
He has some back pains because of the herniated disc, and but the curious thing that it took how long it took for you to get rid of the pain?
Oh,
Do you remember
many
how
weeks.
Sessions?
Yeah, I think
More or less
3 or 4.
3 or 4 sessions.
3 or 4.
And now he's really smart because he's preventing new problems. But it's interesting because can you tell a little bit about the story of your pain, just for people to understand exactly what was going on?
Yeah, well, I first felt it after extended hours at the computer.
Okay.
And,
All right.
yeah.
And for how long were you feeling the pain?
Oh, I would say
Before
at
coming-
least 6 months.
6 months.
Yeah.
Okay.
Where it became a little bit unbearable, really.
Okay. And drugs? What kind of drugs that you were using? And
Yeah, painkillers.
painkillers.
Painkillers basically every other day.
And it starts to make it worse, right? Because if you're just on painkillers, it's exactly what we are talking another day. That when you're taking painkillers, you keep doing the things that are damaging your spine.
Yeah.
So
it really makes things numb. Yeah, a bit numb. So
in
the alarm doesn't really go off.
in a certain amount of time, the thing is, usually the pain starts, the painkiller starts to not making an effect. Is that correct?
That's right.
That's
Yeah.
Okay. So herniated discs is a very interesting situation. It's a very interesting pathology. A lot of patients that come with herniated disc, I have seen it's common, not always, but it's really common, like 90 or 80% of the cases. The sacrum, it's a little bit horizontal, and the spine that should have a curve has a rectification. In other words, L5, the joint L5 S1 or L4 to L5 usually are doing a lot of movement, and the other part of the spine, the lower spine, are not doing anything. So these joints that are overstressed, usually are the joints that have the herniated disc. So the idea here with the postural balance method, it's usually the problem is in the posterior chain. The posterior chain is very interesting. We have some chains, and the myofascial chains is one of the components of the postural balance course. And I will show you today something about this exercise. It's an exercise very important to him, and he's really good at doing this because we have trained this a lot. And so the idea of training the posterior chain for the lower back pain caused by the herniated disc is to stretch all the muscles at the same time and making the sacrum to go down and make some curvature on the lower back spine. So, on the lower back. So that's exactly what we are doing now. Okay? Can we show them a little bit of the exercise?
Sure. Here? Yeah.
Yeah.
Okay.
So, this is an exercise. This is, again, it's really difficult, and Ed is a professional in doing this. All right? And you will see how good he is on doing that. And I have seen plenty of healthy people, very athletic, that cannot do in the same way that Andy can do. All right? Can we show
Give it a try? Yeah.
Okay. So it will be really fast, just for them to have an idea. So let me put this a little bit. Yeah. So please come here.
Side on?
Side on. Yeah.
Yes.
So, yeah, if you can come, yeah, if you can come here, that's perfect. So, put your feet parallel.
Okay.
Yeah, make the horse with the knees, bend the knees a little bit.
Okay.
Yeah. So, you can now bend your hip, a little bit flex your hip, please. No. Forward. You should be a professional doing it. So, yeah, a little bit more. Okay, you can
Bend my
go.
knees. Yeah.
Yes.
Okay.
More. You can flex a little bit more. A little bit. Yeah. So keep your lumbar spine with this curve. All right. So grow up here. Yeah, from this point. Exactly. Okay. So yeah, you can put your hands like that. All right. And okay, I will make a strength in that direction. You will make a strength this direction.
Okay.
All right. But I have to wing. All right. So I'm flexing you, not with your head, but with your trunk. Yes, with your hip. Here you have. Yeah. Let me wing. Let me wing. Very good. So flex it here. Yeah. This is really good. You see that Andy has about 90 degrees. It takes a lot of treatment to do this. It's not easy. So more curve here in the lumbar spine. Yes, that's perfect. Very good, Andy. Now, this is the postural balance. In postural balance, we are treating in a static way. Now, we are doing the dynamic balance. So, dynamic balance, we have plenty of movements that we can put together. So, in this case, I was training him how to, for example, it's a functional movement that I'm training him. So how can he get something heavy from the floor without hurting his spine? All right. So Andy, please, you have to keep this curvature here, and you have to bend your knees. All right. So yeah, we're making a squat, but with this curve on the lumbar spine. Yeah, you can do more curve here. More. Yes, exactly. Andy, okay. Can you go a little further? Yes, perfect. That's enough. And then come back. Come back. Please keep your curve. All right. So I will make the strength again, and exactly curve, and you can go again. Exactly. Very good. And you can come back and relax a little bit, my friend. Okay. Very good. Please take a seat.
Thank you.
That's great. We have also the emotional balance, but it's another story that we have to talk another day. So if you are interested in that, you can check it out in English in www.handsonseminars.com, and in Brazil www.physion.com.br. Thank you very much for your attention, and I hope to see you in the future. Bye.